My name is Hakan Yilmaz, and I am the founder and the inventor of the PowerSlider, the automated medical device that transfers the patient from one place to another. So about MedikEquip, our mission is to improve patient-safe handling and to reduce the risk of injuries to the staff and to the patients that in the hospitals. We know every day in hospitals and nursing homes, caregivers and medical staff use their backs, arms, and shoulders to manually move patient from one place to another. Imagine a nurse who weighs 120 pounds, has to move a 300-pound patient along with her colleagues, his or her colleagues, from one bed to another. MedikEquip is trying to solve that problem, to address this issue where the nurses facing every day in the healthcare environment. The rates of the musculoskeletal disorder injuries due to the overexertion in healthcare occupations are among the highest of all in the United States in the healthcare industry. If we look down at the bottom of the slide, you'll see that 33 out of 10,000 injuries is the average across all industries for overexertions. When we look specifically at the hospital workers and nursing homes, workers, we see these numbers are significantly higher. It's the double national average for hospital workers, 68 out of 10,000 employees. And when we look at the nursing homes, that increases even more. It's 107 out of 10,000 cases, almost 3 times as the national average. So the major problem that we are seeing in the healthcare system today, the first one is the impact on the patient. It is an impact on it impacts their safety, their comfort, and their dignity. Patients risk further injuries or bodily pain during the full body transfer from one bed to another due to the unequal force that are exerted by those caregivers during the transfer. Fortunately, MedikEquip has came up with a solution, and this is called the PowerSlider. Our patented device key features are it is fully motorized device that transfers the patient from one bed to another using its mechanism using its powered force. One of the benefits that PowerSlider delivers is to reducing staff immediately by 50%. We'll discuss this in a later slide more. You'll see the PowerSlider in action. My video works. Forgive me, the video. So unfortunately, it's not working, but I will be moving the cursor. So hopefully you'll see that it's physically, as you can see, the way it's done currently, it's physically. And this patient is actually not acting. She recently had a hip surgery. 4 people moving that patient with 4 different forces led her to have that extreme pain. But we're replacing that. We're bringing a PowerSlider, and as you can see, by simply push a button to activate the PowerSlider on the sheet that is underneath the patient. It brings the patient from one place to another, from one bed to another with no staff force at all, with no human strength needed. The nurses only guide the patient over from one place to another. So, well, our competition, there are a few competitions for this product in the market. The first one is the HaverMat, which is the air mat that goes underneath the patient, and that stays underneath the patient as long as the patient is in the hospital. It's a slippery material that stays underneath the patient, which is hazard, could lead the patient slip from the bed and fell. And according to FDA side, there has been so many cases filed through that side, and in some cases are severe injuries, in some cases fatal cases also have been reported because of the patient laying on slippery device. The other competition we have in the currently is the Maxi Sky, which is the skylift, which you need to, each inpatient room must have one of those lifts or skylift in the room in order to be able to do the procedure, transfer the patient from one place to another. And as you can see from the picture, it really twists the patient and moves everything, moves the patient, twists the patient. So imagine someone with a hip surgery gets lifted, as you can see from the picture, the way you gets lifted, or a back injury, recent back injury gets lifted by the skylift. It's the same concept with the Hoyer lift. It lifts it what they exist in the market, and what they bring when they lift the patient, as you can see, also they twist and turn the patient while they are lifting, while they're transferring the patient, and they have to physically lift them off of the beds in order to do the transfer. Another product that is currently used is the slider sheets. As you can see, the staff physically transferring the patient from one place to another using this slider sheet. The PowerSlider will replace the human strength. The person on your left, you can see on your screen, on the left who is pulling, that will be replaced by the device, which we will use those sheets that he is using to pull. We replace the human putting the device there to pull the patient from one place to another. And lastly, the current also product in the market is the patient transfer board. This is mostly used in the by the EMTs and the in emergency cases, in the emergency room, as well as the EMTs. The PowerSlider version 2 will adapt this board as well, with along with the slider sheets, combining the mechanism that the PowerSlider has with the board and the current product in the market, which is the slider sheet. Together, we will revolutionize the patient lateral transfer industry. Now we have reviewed a couple of competitions. We can compare them and see the difference and see the benefits from the PowerSlider. As you can see from the analysis that we've done, our product is reduces the cost per transfer. It's the cheapest cost per transfer on the list comparing to our competitors. Our product also eliminates the need for human strength to pull, transfer the patient. The PowerSlider also retracts back to the device. That's the sheet that it uses to transfer the patient. We leave the patient laying flat on the bed, so we don't, and on the linens that are approved by the hospital. No hazard material stays underneath, no slippery material stays underneath the patient. We have identified the total available market, and it is our terms over $20 billion a year. That includes hospital beds and other patient handling devices are in the market, currently existing in the market. We really believe that our serviceable available market is about $1.2 billion. That is specific. We'll speak about it in the next bit more in the next slide, but more specifically to patient transfer devices that are available in the market. We see ourselves in direct competition with that serviceable available market of over $360 million. A bit deeper dive here and look at the global market growth. The growth is expected between 2022 and 2026. The market by 2026 should have a growth of over $700 million. The PowerSlider has 2 granted patents, 2 pending, 1 US, 1 international, and has 1 pending trademark. The PowerSlider is also FDA Class 2 exempt, and it falls under the FRZ product code. We are in talk with the representative from the FDA, and we came into conclusion that is where it falls under Class 2. We have generated some tractions. We have been attended Medica in 2021, as well as Arab Health in earlier in January of 2021. And we have places around the world within the US and Europe, as well as the Middle East, whom are willing to pilot the PowerSlider. Furthermore, traction, we have also, we are in communications with major companies such as Stryker, Arjo, and Medline within the US, whom are also interested in the PowerSlider, perhaps licensing or buying the PowerSlider eventually. Timeline, our plan is to be in Medica in 2 weeks from today, and to revisit our previous connections, to plan our 2023 Arab Health visit to show the PowerSlider in action at the trade show. We are expected to have one of our one unit be ready for us by December, one PowerSlider ready by December to be able to show it in Arab Health, and by February of 2023. Our plan is to get right after that to get the FDA clearance done and start producing 3 devices to be able to pilot it by fall of 2023. So we need your help to connect with hospitals to pilot PowerSlider, research institutions to test and study the benefits of this device, and perhaps connections with healthcare investors. I would like to introduce my team to you, and you already know me, and I would like to introduce Sam and Chandler, as well as Kent and Stephen. They are the advisors for MedikEquip. And also, I would like to highlight the Washington life science mentors that we have through the Life Science Institute. I would like to introduce Pelin, Del, and Mark, whom just been helping us think through some of the key challenges we have addressed as we brought this product to life. Thank you very much. I'm happy to answer any question you might have. Sorry if it came across a bit, if
You
I
did
was a bit
wonderfully.
nervous.
You did wonderfully, Hakan. If everybody could
Thank
just
you.
take a minute, either virtually or through your video, give Hakan a round of applause. That is
Thank
awesome.
you.
So I learned so much, and I've spoken to you a few times, so I would imagine that there'll be some really good questions online. We have some lots of experience. Wow, Alan, that's very exciting. So can I open it up for questions right now for anybody who's online?
Absolutely. I'm happy to answer any questions you may have.
Perhaps I could start if that's all right. Can you hear
Yes,
me?
please.
Okay, good. Hakan, I have seen your slides a number of times, and I'm just so impressed with how you have been taking feedback with regards to developing the content in a manner that's a more explanatory and graphically more interesting. I still, you know me, I still always have a comment or two, but I just want to tell you how much I'm impressed with it and how tightened up your story has been. So the one thing that I did want to ask a little bit is if we could go to your pricing slide.
Absolutely.
That's one. So if you're the cost per patient transfer at $6, I know that that is a cost that's based on after having done the capital purchase. Well, I don't know, most it depends. 5,000 could be a capital purchase, but $8,000 purchase, then it reduces the cost on this. But if I was just not thinking about that in terms of numbers, I might still say $16 per sheet is a lot cheaper for buying this over the cost of goods. Can you comment on what you would say to a purchasing department that's actually looking at that?
Absolutely, and thank you for the question. First, if I may just make a comment. Actually, Chandler Lewis here, he's also my senior advisor. He actually helped me a lot with this slide sheet. So thank you, Chandler. As you can see, it's turned out to be great. So to answer your question, Elizabeth, yes, thank you for this question. So the cost per transfer, actually, it's the device itself, it's not calculated into this cost. And the reason being, it's because as you know, if you pay $8,000 with the time that if I calculate based on that, I won't be able to give you an accurate estimate per transfer for 5 years from now, right? Or let's say a year from now, rather, because the price goes down as you use it, right? But what I have done is cost per the material that are disposable, and I can expand on that. For instance, and the manual transfer sheet, right? So it costs $16 per sheet, yes. However, you have staff time. 4 staff members need to transfer the patient, and if they get injured, the cost of their injuries, if when they get injured and they go on leave, the cost of replacement, all of those are actually would increase the cost per transfer significantly. So now what I have taken is cost of per sheet, that for slider sheet is they cost $16, but I also counted staff time, came up with what will be the $12 per one transfer. And would be the same case for the mobile air. So the air mat itself, that the inflator, that is one-time purchase and costs about $2,700. But the mattresses are costing about between 60 to 70. Depends on how they buy it. But I took an average number, and when I calculated staff time, that's what we came up with. How many times those devices are used before they get disposed. The types that are used for the slider sheet, the air mat, and the Hoyer lift sling, all I calculated the same of 12 uses then disposed.
Okay, thank
I
you
hope
for,
that answers your question.
it does provide some additional clarification. Thank you.
Wonderful.
Yes.
And I see that Chandler has put the video in the chat. So if anybody wants to see the PowerSlider in action, we can do that after the presentation. Are there any other questions that anybody has? And thank you, Elizabeth. That's, of course, I would only expect a very technical, good question from you. Thank you so much for that. Really, it's Chandler, did you want to say something?
Yeah, no, I one of the reasons why I really believe so much in this product is I spent 3 years as administrator of a nursing home in Washington State here in Seattle, and I've spent so much time working with CNAs, a lot of CNAs, caregivers, both in home health and in my clinical environment. Where it really takes so much work to train people on how to move patients. And so I think when we think about the cost of this device, I know looking at this competitor analysis here, we kind of, have a pretty low cost transfer, but still the device cost is fairly high. But what you're really factoring in here, and I think Elizabeth, you kind of, in speaking about the purchasing, I really think this is a much larger conversation within the health system about reducing the risk to patients, that cost benefit that you're realizing from the patient perspective, but also, this is one of the top 5 like injuries in, the musculoskeletal injuries from, lifting specifically, which is billions of dollars in, lost wages and time. And I can tell you, the reality is in a lot of limited resourced care settings, people just don't get moved, right? And so, the ability to move patients really can provide a quality of life, and also, save a lot of people's injuries. I mean, staff all the time were in my facility were struggling with, the physical pain of moving patients all day. So I think, just from my perspective, I this is why I support it. I think it's such an incredible solution that really saves so much effort and fits well into the clinical workflow already. So.
I agree with you. And, I'm a physical therapist. And so I not only do I see the benefits for staff and for patients, but I also see the benefits of moving patients, because decubitus ulcer, I think what it is that this pricing thing doesn't really translate. It talks about a material cost, right? It doesn't actually talk about the impact of cost savings that you could actually have.
Yeah.
The value. And so if you talked about decubitus ulcers and said the number of patients who actually have that because the staff don't actually remove them because there's too many people who are actually requiring to be there. And, I just looked at the average of the numbers of hours of care in a full-term, long-term care facility, 3 hours a day.
Mm-hmm.
Well, 3 hours a day means that many, even if you just talked about bathing and getting someone ready for eating, we're not talking about going in every 2 or 3 hours and moving people around. And the cost per decubitus ulcers is high.
Thanks so much, Elizabeth. I think, you see it, right? You see the impact of the product, and I think we all appreciate that.
Absolutely. And so we actually are running a little bit short on time, but I do want to say thank you very much, Hakan, for sharing this with us. I can see, so I do a lot of work with facilities, health aides, that sort of thing. And I can definitely see this being used in those settings. I'm curious how many would, like, say your average nursing home or care facility, how many of these devices do you think that they would need to purchase? Just, I know that's a wildly different question, but just, would it be one per hospital or one per floor, or what are you thinking, Hakan?
It most likely would be, the goal is for each unit to have at least one. But the way our hospitals are designed are a bit different from even state to state. Like in Seattle, it's in Washington State, one unit they are the rooms are facing technically each other, they can transfer this unit in between on one floor, 4 units, right? And in Chicago, it's different. The way they have designed it is that each unit is separate, same floor, so each unit will need a device. So one floor can have in a hospital 3 devices, and one floor in other hospital could have 1 or 2. I hope that answers
Wonderful.
the question.
So I am going to do one last open for questions. Is there one last question that anybody would like to ask before we close? No? Okay. And Hakan, can you remind us, how can we as Alaskans help you move your product forward? You've got some more steps that you need to go before we could just, order one and have it tomorrow. But what can we do right now to assist you?
Absolutely, and thank you for the question. We're looking into finding. I'm going to go to that slide so you can also have it on the screen. What we need to be introduced to hospitals or hospitals, investors, and or research institution mostly. We would like to find a way to expand beyond where we to show, to do more research and show that this product is will be very helpful for the healthcare environment.
We'll do our best, Hakan. I love to make connections, and I'll get started on making them for you. So thank you so much for joining us today.
Absolutely. Thank you so much for your time. I appreciate it. Thank you, everyone.
Okay. Thank you
Thank
all
you.
for
It was a
coming.
great presentation.
Thank you.
Thank you.
Thanks, man.
Bye-bye.
Thank you all for coming. So the next Health Tie Open Innovation will actually be on November 10th, and we have a local innovator. She's created Guidepost Pediatrics. So please join us for that if you can. So wonderful to have you all here, and I'd look forward to connecting with you all offline. So thank you again, Hakan. We'll talk to you later.
Thank you very much. Have a wonderful
Thank
day.
you.